Welcome. I am Harvey Pearl from Pearl and Company, and I'm here today with my colleague Rafael Quintero, and we're going to review some Medicare. There he is. And we're going to review some basics in Medicare to help you build your foundation of knowledge. We're going to walk through this carefully and slowly, try not to overwhelm you with too many details. And you're welcome, Barb, and hello, Sally, and good to see you all. I'm glad you're able to join in. So we'll move along. So Medicare basics. If you are up to turning 65 sometime soon, or are eligible for Medicare due to some other reasons, perhaps like a disability, these are essential tips to understand what your options are. So we'll start with the basics. For people who are 65 or older, and U.S. citizens or permanent residents, all of you are eligible to sign up for Medicare. If you have a disability and receive Social Security disability insurance, you may be eligible for Medicare after 24 months. If you have end-stage renal disease or are on dialysis, you also may be eligible for Medicare. And if you have ALS, you would be eligible for Medicare immediately upon diagnosis. In Medicare, there are various parts, and these are the basic foundations of Medicare. Part A is called hospital insurance, and this is what covers when you are in the hospital, when you are admitted, not there for observation, but when you are actually admitted. It also covers hospice or end-of-life care, skilled nursing facilities, also known as rehab or transitional care units, TCU units, and for home health care. Part B is known as medical insurance, and predominantly that covers doctor's visits, which is any kind of doctor, any kind of specialist, therapist, anyone providing service. Outpatient care, preventative care, certainly. Durable medical equipment, walkers, wheelchairs, canes, hospital equipment, bathroom accessories, and diabetic continuous glucose monitors would fall under Part B. Most vaccinations also fall under Part B, such as flu, pneumonia, COVID. Interestingly enough, shingles falls under Part D. Not really sure why that is, but it does. And there are also certain oral medications that, even though they're not injections, they fall under Part B. And those are some of the examples of the exceptions to Medicare, of which there are always many exceptions that come along the way. Part C is also known as Medicare Advantage. They are synonymous. They are one and the same. And Part C Medicare Advantage plans are similar to what you've known for many decades. It's pretty much exactly the same. So it's an all-in-one plan that includes Parts A and B, hospital insurance and medical insurance, and typically offers benefits such as prescription drug coverage. Although there are plans like for veterans that get their medications from the VA, they can have a Medicare Advantage plan without prescription drug coverage. And then there's Part D. Part D always means drug coverage. So it covers prescribed medications and are typically included in Medicare Advantage plans or can be purchased separately to ride alongside original Medicare or a Medigap Medicare supplement plan. The cost for hospital stays is what Part A addresses. But there is a deductible in Part A, and that covers a 60-day benefit period. So if you go to the hospital today and you're there for 3 days, and you come home and you go back next week, you're in the same 60-day period. That deductible would apply to that 60-day period. However, if you go to the hospital today for a few days and then you come home and you go back in several months, maybe 4 or 5 months, that would be a new 60-day period. So the Part A deductible covers a 60-day benefit period. In Part B, predominantly we think of doctors, and it has a yearly deductible. And so there's a deductible to Part B, and you are responsible for 20% of the bill. Medicare only pays for 80% of doctors' services. But the various plans, the Part C Medicare Advantage plans or the Medigap Medicare Supplement plans, address that 20% responsibility in different ways. Monthly premiums do apply in the world of Medicare. And in Part A, most people don't pay for a Part A premium because they have put 40 quarters of FICA into the Social Security system over the years of their employment. But Part B premiums are always paid and always need to be paid, and they vary each year based on what your adjusted gross income was 2 years ago. There is always a 2-year look back, and there are 6 different price tiers that determine what your Part B premium might be. And that premium changes annually. So what might be a high premium this year could be a low premium next year if your adjusted gross income went down in the subsequent year. And we can go into more details as they apply to each of you individually. When you enroll in a plan, you have 3 choices. The first one is Original Medicare. That's what started in 1965. It's a premium-free option. It comes with Part A and Part B automatically. And then Medigap or Medicare Supplement is what helps fill in the gaps of what Original Medicare does not provide, such as paying for the 20% of Part B or for the Part A deductible. And then Part C Medicare Advantage. That includes A and B and typically D, unless you're a veteran and you don't need Part D coverage. So there are 3 basic ways to engage in a Medicare plan. In Original Medicare, the original basic construct, the Part A premium is typically 0 in most cases. But the Part A deductible this year in 2025, the deductible is $1,676. That's that 60-day period deductible. And that deductible goes up a little bit every year. In Part B, there's always a premium. Think of the premium of Part B as like membership dues to belong to Medicare. If you don't pay your membership dues, you can't belong to Medicare. So it's critical that the Part B premium is always paid on time. This year, the entry-level premium starts at $185, but it could go up in 6 different stages, depending on what your adjusted gross income was 2 years ago, as high as $626.70 a month. And if both you and a spouse are both in Medicare at the same time, that premium applies to each of you individually. There is a deductible in Part B. If your Part A date is after January 1 of 2020, you will have a Part B deductible of $257 in the year 2025. Last year it was $240. Next year it will be something a little bit higher. But if your Part A date precedes January 1 of 2020, then there is no Part B deductible. You are exempt. And once again, Part B only covers 80% of the bill. So you are responsible for 20%. Once again, the Medigap plan and the Medicare Advantage plans address that 20% differently. And then Part D plans. Depending on the kind of plan that you choose, there could be a premium, but there is always a cost of medications. No matter what kind of plan you are in, the cost of the medications themselves is always your responsibility. Sometimes the medications are $0, but that's considered a cost. So that would fall into your column. In the Medigap Medicare Supplement plans, typically most people fall into plans F or G. You will see a lineage of alphabet soup when it comes to picking Medigap plans. But the 2 that most people fall into are F and G. If your Part A date precedes January 1 of 2020, you will typically be an F. And that makes you exempt from the $257 Part B deductible. If your Part A date is after January 1 of 2020, then you are a G, and you are responsible for the $257 deductible. That deductible is simply the very first doctor's appointment that you have in a calendar year. You are responsible for the first $257. Once that is satisfied, you're done for the year. So if the first doctor's appointment is $100, you still have $157 left to spend before you have satisfied the Part B deductible. But once that is spent, you're done for the rest of the calendar year. With rare exception, and I don't know what the exception is, but this is Medicare, there's always a possibility. There are Plan N plans, but they're stripped down versions of Medigap plans. They come with a lower premium, but they're kind of a hybrid between a Medigap plan and a Medicare Advantage plan in that it has some copays along the way. So doctor's visits could be $20 per visit. Emergency room visits could be $50 a visit. And those things don't tend to happen in Medigap plans. But if you want a lower premium in a Medigap plan, a Plan N might be an option. And as the flashing message came up, if you have any questions, just type them into the chat so we can address them. In those Medigap plans, you can see any provider nationwide who accepts Medicare as full payment. This is a question you want to get into the habit of asking now. With every doctor's appointment that you make, you want to ask if the provider you are going to see still accepts Medicare as full payment. If the desk clerk responds with something like, yeah, doctor takes Medicare, we love Medicare, woohoo, Medicare, yay, that's not an answer. You want to know specifically if the doctor you are going to see still accepts Medicare, because doctors can change their minds and they can decide mid-year, I don't want to take Medicare anymore. And the reason why they would come to that decision typically is because Medicare underpays the value of their services. And basically they're making it up on volume, but some doctors have come to the point of saying, you know what? It's just not worth it. It's not worth the paperwork. It's not worth the billing. It's not worth the time it takes to get paid. I'm just not going to accept Medicare anymore, or any insurance for that matter. And they just work with their patients on a private census where the patients pay them directly at full retail. So you want to get into the habit of asking with every appointment. And if the desk clerk doesn't know, then ask for a supervisor. And then write down the person's name and the date that you spoke with them. Because what you don't want to do is get a surprise bill. Now let's play that out one additional step. Let's say you're going in for a procedure and there are multiple people going to be in that room, maybe an anesthesiologist and other techs and other specialties will be in the room for that procedure. You want to know in advance, does every single person who's going to be in attendance accepts Medicare as full payment? And the response may be, we don't know who's going to be scheduled that day. Okay, find out who's going to be scheduled that day. Because what you don't want is a surprise bill from the anesthesiologist because that doctor doesn't accept Medicare. But if you don't ask in advance, you'll never know. Once those surprises happen, they're irreversible. They're not negotiable. So this is a point of self-advocating. We strongly encourage it. In Medigap plans, riders are available, and we tend to lump them all into the total premium so that you know exactly what you're going to be paying for. And there are riders that address the Part A deductible, that's $1,676, and the Part B 20%, so that those gaps are filled in so that you have zero bills. And with rare exception, there are no additional costs in a Medigap plan. But we always say a rare exception because there's always a possibility. But pretty much Medigap plans are all inclusive. They come with a higher premium. than a Medicare Advantage plan, a steady premium, so you know what to budget for every month, but there are no copays, there are no co-insurances, there are no maximum amount of pockets that you're adding up to in a Medigap plan. You just pay a flat premium every month, and it's pretty much all inclusive. Medigap plans also offer additional flexibilities. In some cases, some of the plans offer international medical coverage in the case of an emergency. So if you are overseas, it might address those costs of medical coverage up to a certain point. And then some plans have a way to kind of fill in whatever missing gaps there are. Again, we can go into those details when we speak one-on-one, but depending on the plan that you select may have different features available. So that's Medigap. Now we'll touch on Medicare Advantage. Medicare Advantage plans usually work with networks, much like you've been used to for many, many years. You have a network of providers and you play within that network of providers to keep your expenses minimized. And that's to respect your costs. So if you play within the network, you're going to pay less typically. And these plans offer comprehensive coverage. So they tend to include the coverage for prescription drugs, but you always pay for the cost of medications. And many of them also offer dental, vision, and hearing features that you've heard advertised on TV, and additional services, gym memberships, and things like that. But keep in mind that dental is not always a grandiose amount of dental coverage. Depending on the plan that you get and the premium you pay, dental could be $500 worth of coverage, could be $2,500 worth of coverage. It all depends on the plan that you choose. When they touch on vision, they're looking at routine visits as well as medical visits. The difference between routine and medical vision visits are, if I was just going to the doctor for an updated lens refraction, that's considered a routine exam. Typically, Medicare does not pay for routine exams, but the Medicare Advantage plans might entitle you to 1 or 2 routine exams per year. Medical costs for visions tend to be covered by Medicare. Those examples would be cataracts, glaucoma, monitoring diabetes for retinopathy, and other sorts of diseases of the eye that an ophthalmologist would address. And then hearing is not just the audiologist, but the equipment, the hearing aids themselves. Some of the plans, many of the plans address those costs as well. And again, depending on the plan that you choose, depends on how much coverage that there is. Many times you'll hear the TV ads talk about $0 premium Medicare Advantage plans. And that sounds wonderfully attractive, except for the fact that the TV ads don't tell you the rest of the story. And what we mean by that is when you look at maximum amount of pockets and all those copays that add up to a maximum amount of pocket, that maximum amount of pocket tends to be a seesaw compared to premiums. So if you have a $0 premium, you might have a $5,000, $6,000, $7,000 maximum amount of pocket. If you want to bring this down, you pay more in premium. Now, let's say it's about a $50 premium, you may have a $4,000 maximum amount of pocket. You want to bring this down a little further? Maybe a $100 premium will bring this to a $2,400 maximum amount of pocket. So there's this inverse relationship between premiums and maximum amount of pockets. They always work in reverse like a seesaw. So when you hear those very attractive ads of $0 premiums, remember you might be paying for it elsewhere. Some Medicare Advantage plans also offer additional flexibilities, allowing visits to specialists without a referral. This is typically what would be found in a PPO, a preferred provider organization plan, where you have a larger choice of providers to choose from. So not just a primary care physician is in that larger circle of providers, but the specialists are also, and you don't need a referral to see those specialists. If, however, you go with an HMO, which is a health maintenance organization, a smaller number of choices, then you have to have a primary care provider that would need to give a referral before you can see the specialist within that smaller network. And if you don't get the referral, the insurance company is not going to pay for that specialist. So the referral becomes rather critical. Think of the referral as giving you permission to see that specialist. So you just need to know what the rules of the game are on whether or not you have a health maintenance organization, HMO, or a larger network to choose from in a PPO, a preferred provider organization. And then the world of prescription drug coverage. In original Medicare, the original construct, prescription drug coverage is not included. So you would purchase what's called a standalone prescription drug plan, PDP, and that rides alongside your original Medicare plan. It comes with its own premium, and there's always a cost of medications. And if you don't have prescription drug coverage, you could face a lifetime enrollment penalty. So for example, if you take no medications, and you would naturally think, why do I need a prescription drug plan? I take no medications. One of the many, many rules of Medicare is you must have prescription drug coverage even if you take no medications. Because if you don't, later on, when you do ultimately enroll for a prescription drug plan, you will be charged a lifetime penalty for every month you did not have prescription drug coverage. So that becomes a very critical thing to take care of. And we would help walk you through that and help you select a plan. So you've got original Medicare. Now you've got Medicare Supplement, Medigap. Like original Medicare, prescription drug coverage is not included. So you would have a standalone PDP to go alongside that Medigap plan so that they walk together. And again, there is always a cost of prescription medications. And then lastly, again, there's Medicare Advantage, Part C, which typically includes the coverage for prescription drugs as part of the plan. But again, there's always a cost of the medications themselves. There are various enrollment periods to get into Medicare, and they're rather important that we know which enrollment period we're choosing to make sure that we don't have difficulty getting you enrolled. So when you're enrolling for the very first time, that's called the IEP, the initial enrollment period. It's a 7-month period that starts 3 months before your 65th birth month up to 3 months after your 65th birth month. And that's your initial enrollment period. If you have individual health insurance coverage before you get into Medicare, then this would apply to you because you must apply for Medicare number and enroll in a plan in that 7-month period. If, however, you are either an employee in a group health insurance plan or the spouse of someone who is in a group health insurance plan, this would be deferred. You do not have to enroll in Medicare at age 65. You can keep on going until that employee decides to retire. That could be at age 68, age 70, whenever. So your Medicare is deferred. Your expectation to enroll is deferred. No, you will not be penalized. So when your friends and family are saying you must apply at age 65, that depends. It depends on if you have individual insurance or you're part of a group health insurance plan. The general enrollment period applies if you miss your initial enrollment period. And that general enrollment period, the GEP, is between January 1 and March 31 of that following year, but you may have to pay a late enrollment penalty for not having enrolled in your initial enrollment period. And then there's special enrollment periods throughout the entire year for various reasons. Something as simple as you moved. You moved from one county to another county or one state to another state. In the world of Medicare Advantage, the plans are county-based. So in the Twin Cities market, for example, there are 4 major counties. Those plans tend to be the same. But if you're up in Crow Wing County or down in Olmsted County, they have different kinds of Medicare Advantage plans because the networks are different in those remote rural areas of the state. Other special enrollment periods are if you're rolling off of Medicaid or medical assistance. If you have been in jail and you get out of jail, that would be qualifying for a special enrollment period. There's a whole lineage of choices of special enrollment periods that help us identify when you can be eligible to roll into a plan. These are some of the changes that have taken place for 2025. Parts A and B had some changes in deductibles, the coinsurance, and the premiums due to inflation and other healthcare costs. You should know that co-pays and deductibles and maximum out-of-pockets are measured in dollars. Coinsurance is measured in percentages. So, for example, an X-ray at 20% versus an X-ray at $10 or $20. So it's important to know, are you being charged a percentage of a service or a dollar amount of a service? Some of the preventative services have changed for 2025. Telehealth has continued to be extending its coverage because we learned a lot from COVID, and one of which is telehealth matters, and especially for those in more rural areas where access to providers may be a little bit more challenging, telehealth becomes that much more important. So there has been an expansion of coverage available there. So it's all about accessibility. They have decreased some of the benefits in some of the in-network prescriptions. Some of the gym memberships have changed their rules. Transportation availability has been available in certain programs. We've seen some changes there. Dental, vision, and hearing benefits have also changed in some cases in 2025. And lastly, select plans have eliminated broker support to advocate for their clients. So as a result, they're not recognizing us to work on your behalf, to advocate for you. And we know which plans they are, or which carriers are promoting those drops of broker support. What that basically means is if there's a challenge and you choose a plan that the broker no longer can support and provide assistance, then you're kind of on your own. And so while we may be able to give you advice, we cannot be on the telephone with you because they won't even speak with you until we hang up. So those are things that we have to just be aware of so that you can choose if you want to work with a plan that has broker support or does not. In Part D, some of the updates, the formularies in some cases have expanded in drug coverage, including some of the higher cost medications that have not been available in previous years are available this year. And that famous donut hole that you've heard about has been eliminated. So they simplified how medications are paid for. There used to be an $8,000 price that you would pay medications up to $8,000 before the prescription drug plans took over at 100%. Because of the Inflation Reduction Act, that $8,000 maximum amount of spend has been reduced to $2,000. And part of that readjustment was to get rid of the third stage, which was the donut hole or the coverage gap. And that simplified things quite a bit and made access to prescription drug medications more accessible to more people. There's also been some drug price reductions. CMS is the Centers for Medicare and Medicaid Services. That's the federal agency that manages Medicare services and obviously Medicaid as well. And they are now able to negotiate prices with pharmaceutical houses on the cost of medications, trying to lower costs to make medications more accessible for more people. So they're trying to get things discounted. They're trying to make things accessible. The Inflation Reduction Act, again, reduced the maximum spend on medications, on prescribed medications, from $8,000 down to $2,000. The important word here is covered. Uncovered medications So we have a client who last year, her cancer medication was covered, and it was $1,700 for the year for that one medication. Now, this $2,000 covers all medications combined. Well, this one medication was $1,700 last year, but this year it's not a covered medication by that plan. So the price only adjusted slightly to $385,000. Well, we had to figure out, can she accept the generic to that medication, which is a lot less expensive, or was she required to use the brand version of that medication because it works differently? So these are case-by-case situations that we help you work through. The Bipartisan Budget Act allows Medicare Advantage plans now to offer some special benefits for those who are chronically ill. So chronic illnesses are things like cancer or diabetes would be a chronic illness, or some certain pulmonary circulatory illnesses could be considered into the chronic condition. Telehealth services, permanent coverage has been expanded for telehealth, which is very wonderful for the increase of patient care. And it is becoming more and more of what people in rural areas are relying on, because it's helping them be in touch where they've not been able to be accessed in the past. So the big summary of this is, we don't know what we don't know. We don't know what our health is going to be like in the future. We don't know what types of situations are going to be happening. And these are the types of things that we try to help you address in our ongoing education to make you smart, so that you're making the best decisions for the Medicare plan that works best for you. And that's what we help facilitate. And then after we work on all those details together, we conduct the enrollments. So while there is no charge for our time for you throughout the entire year, and we want you to call us and never hesitate to call us throughout the year, the expectation is you will let us enroll you in the plan so that we can get paid by the insurance companies. It's important that you know that we are not incentivized from one insurance carrier or plan to another. Rather, we are your fiduciary. We are always acting on your behalf as your advocate. So the example we give is that if we whittle it down to two different plans, and one has a higher premium, one has a lower premium, and we think that the higher premium plan more accurately suits your needs that you've shared with us, it's not that we're getting more money out of it because it's a higher premium plan. It's because the features make sense. And so you should always know that we're always working on your behalf. There are no stupid questions. All questions are valid. All questions are legitimate ones. And repeated questions are even better, because we want to make sure that we know that you understand what we're explaining. And if not, then we need to find different ways to explain things so that they're understood. Sally, I'll get you a question in a moment. Anything and everything that you share with us is kept private and confidential. As a former nursing home administrator, there are more things that I'm familiar with in terms of illnesses and challenges at this stage in our lives than most. And all the more reason why we feel equipped to be able to help you in your needs. With regard to, can you change plans from year to year? Yes and no. So that will make it really simple. The reason why both might apply is it depends on if you apply to a Medicare Advantage plan first and you want to go to a Medigap plan. If you have certain health conditions that could be denied in underwriting, then maybe not being able to move to a Medigap plan, but you could move to a different Medicare Advantage plan. So it's a great question, and we're going to get into more of those details when we speak one-on-one. But as a general rule, pre-Medicare, there are no pre-existing conditions because of the ACA, the Affordable Care Act, Obamacare. But in Medicare, it's all about pre-existing conditions because we're older and we need new parts and hips and knees and et cetera. Except the first 6 months of your Part B effective date is an extension of no pre-existing conditions. In those first 6 months of your Part B effective date, you can walk into any Medigap plan as healthy or as unhealthy as you might be, and you will be accepted. It's called guaranteed acceptance. You are guaranteed issued a policy in a Medigap plan. After the 6 months, you have to go through underwriting to be considered for a Medigap plan, and they can deny you. So while we can't be denied pre-Medicare, perhaps you could be denied a Medigap plan once you're in Medicare. Our email address is wisdom@pearlandcompany.com. Pearl is spelled P as in Peter, E-R-L-E, and company.com. Take a look at our website at pearlandcompany.com. It'll give you an idea of some of the additional things that we take care of. We do not have voicemail, and we're really proud of that. Only humans answer our phones. And if I'm unable to answer, Raphael certainly will, or Jennifer, or our receptionist backup. So that's a lot in a very short amount of time. I hope some of that has stuck with you. If maybe 25% of it has, consider yourself ahead of the class. Do not feel that there's something wrong with you if you can't understand Medicare on the first round. It's too much information to understand on the first round, so there's nothing wrong with you. It's a lot to go through, and we would love to have the opportunity to speak with you one-on-one to discuss your needs and see how we can find the best path for you. 651-303-8889. You're welcome, Sally. Thank you for joining us. Andrea, good to see you. Barb, hey there. Glad you were all able to join, and we hope to speak with you all soon. Be well. Bye-bye.